Sclerosing adenosis of the prostate is a fairly rare lesion that is important to recognise. Originally it has been called a fibroepithelial nodule and adenomatoid tumour, and in fact I had one of these to report a number of years ago and did some immuno to determine if it truly was an adenomatoid tumour, and the immuno pattern indicated it was not an adenomatoid tumour but a prostatic lesion. So I coined the term pseudoadenomatoid tumour. However, that has now been superseded by a rather more useful term, that is sclerosing adenosis. These lesions occur in about 2% of prostates. They are usually seen in TURP specimens or sometimes prostatectomy, and the reason for that is that they tend to occur in the transition zone. This is the part of the prostate where benign hyperplasia occurs. Sclerosing adenosis is benign, but the problem is that it may resemble prostatic carcinoma. These lesions are usually single foci, but they can be multiple, and the typical size is around 4 millimeters, but they can be up to around a centimetre across. The typical histology is a nodule of closely packed acini. There are two cell types, a pink or clear epithelial cell layer and a prominent basal cell layer, and the stroma is sclerotic and cellular. Here is a TURP chip containing a nodule of sclerosing adenosis. This is a high power view where you can appreciate the highly cellular appearance of the lesion, and at the highest magnification you can see these rather distorted acini lying in a cellular sclerotic stroma. This is the PSA stain. Normal prostate at the right of the lesion is clearly showing strong positivity, but the lesion itself is also showing obvious PSA positivity, confirming prostatic origin of the epithelial cells. Immuno is very useful for confirming the diagnosis, and that is because the basal cells show positive staining with S100. They also show positive staining with SMA, but normal prostate basal cells don't stain positively with S100. This is the SMA or smooth muscle actin stain, showing very strong positivity of the basal cells. And this is the S100, again showing strong positivity of basal cells. This is the stain that clinches the diagnosis of sclerosing adenosis of the prostate.